One of the most common questions I hear in clinic goes something like this. Doctor, I already take a pill for my blood pressure. My blood sugar isn't where it should be either. So just tell me, what should I be eating to protect my heart? It's a fair question, and it deserves a straight answer. Here's the honest starting point. No single food protects your heart. There's no magic item on a grocery shelf that erases years of habits, and nothing on your plate replaces the medication your doctor prescribed. But that doesn't mean food is powerless. Far from it. What you eat day after day quietly shapes the environment your heart and your blood vessels live in. And when someone has a heart attack far too young, in their 30s or 40s, it usually isn't a bolt from the blue. When you sit down and take a careful history, there's almost always a story underneath. Maybe heart disease ran in the family. Maybe there were years of smoking or heavy drinking. Maybe a diet built almost entirely on refined carbs, fried food, and sugar. Maybe high blood pressure, high cholesterol, or diabetes that was diagnosed but never really treated. Maybe chronic stress, poor sleep, and very little movement. It's rarely one thing. It's usually a background that was there all along and simply never got the attention it needed. So the goal here isn't fear. The goal is attention. Now, out of all the foods people ask me about, there are 8 I keep coming back to. Not because everything else is harmful. That's not the case at all. Plenty of foods are good for your heart, but these 8 share 2 very specific properties, and those 2 properties are the foundation of heart-supportive eating. The first is cholesterol. These foods may help move LDL, what people often call the bad cholesterol, in the right direction. LDL is the particle that can slip into the wall of an artery and slowly build plaque. Over years, that plaque narrows the passage. Bring the LDL down, and you slow that process. The second is inflammation. This one gets talked about less, but it matters just as much. Inflammation is what can turn a quiet, stable plaque into an unstable one, the kind that ruptures and sets off a heart attack or a stroke. Foods that help calm inflammation help keep those plaques quiet. Cholesterol and inflammation. That's the entire framework. One thing before we begin, this is general health education, not personal medical advice. If you have heart disease, diabetes, kidney problems, or you take regular medication, talk with your own doctor before making any significant change to how you eat. So let's look at 8 foods that support these 2 goals. Let's start where the evidence is strongest, with the plants. Number 1, leafy greens, spinach, kale, arugula, Swiss chard, collard greens, romaine. These do 2 useful things for your cardiovascular system. They're rich in vitamin K, which supports healthy blood vessel walls, and they're one of the best natural sources of dietary nitrates. Your body converts those nitrates into nitric oxide, a signaling molecule that tells the inner lining of your arteries, the endothelium, to relax and open up. When your vessels are relaxed and flexible, blood moves more easily, pressure tends to sit lower, and the whole system is less irritated. Less irritation means less of that low-grade inflammation we talked about, the kind that drives plaque buildup over the years. The American Heart Association has consistently pointed in the same direction. People who eat more vegetables and more food from plant sources tend to have healthier hearts and a lower risk of heart disease. One important caution here, if you take warfarin, the blood thinner, vitamin K interacts with how that medication works. That doesn't mean you have to avoid greens. It means you should keep your intake steady rather than swinging wildly, and you should talk to your doctor or pharmacist before making a big change. That's a conversation worth having. Number 2, whole grains. And I want to be clear about what that word actually means because the food industry is not always clear about it. A grain has 3 parts: the outer bran, the germ, and the starchy center. A whole grain keeps all 3. When a grain is refined, the bran and germ are stripped away and you're left with the starch. That's white flour. That's white rice. Most of the fiber and most of the nutrients were in the parts that got removed. So whole grains means oats, barley, quinoa, brown rice, bulgur, rye, and 100% whole wheat. Not the white bagel, not the donut, not the sugary cereal or the white sandwich bread. Here's the practical part, the label. Multigrain doesn't mean whole grain. Made with whole grains doesn't tell you how much. Wheat flour is usually just refined flour. Flip the package over and read the ingredient list. You want the words whole grain or whole wheat first, not fifth. Research consistently links a regular whole grain habit, roughly 1 to 2 servings a day, with lower rates of coronary artery disease, lower stroke risk, and better metabolic health overall, meaning things like blood sugar, uric acid, and fatty liver. Whole grains have also been shown to help nudge cholesterol down, and that's another route to protecting the heart. Now compare that with a day built on refined carbs. Pastry in the morning, sandwich on white bread at noon, chips and soda in the afternoon, something fried at night. All of that hits your bloodstream fast, spikes your blood sugar, and gives your body almost no fiber in return. And most of us are not doing the kind of physical work that burns through all of it. Number 3, beans. Black beans, kidney beans, chickpeas, lentils, pinto beans. Beans are complex carbohydrate, meaning slow. They take work to digest, and that's exactly the point. They carry soluble fiber and resistant starch, which pass through to your colon and feed the bacteria living there. Those bacteria ferment the fiber and produce compounds that appear to support your metabolic health. That's why gut health keeps coming up in heart conversations. A well-fed gut is associated with better weight control, better insulin sensitivity, and a calmer inflammatory state. The specifics on beans are good. They've been shown to help lower LDL cholesterol. They help steady blood sugar, which matters if you're managing diabetes, and they're associated with better blood pressure numbers. Cholesterol, sugar, pressure, 3 of the biggest levers in heart disease. One tip, if beans give you gas, don't quit. Start with small portions and build up. And if you're using canned, rinse them. It washes off a good amount of the added sodium. These 3 are your everyday base. Now, let's get to the flavor builders. Number 4, tomatoes. Fruit, vegetable, salad ingredient. Call it whatever you like. What matters is the color. That deep red comes from a pigment called lycopene, and lycopene is where the heart benefit lives. Lycopene is an antioxidant. Now, antioxidant is a word that gets thrown around so much it's almost lost its meaning. So let me explain what it actually does. Your body constantly produces unstable molecules called free radicals, reactive oxygen species. In small amounts, that's normal. But when they build up faster than your body can neutralize them, they start damaging tissue, including the lining of your blood vessels. That state is called oxidative stress, and it's one of the engines behind inflammation. Antioxidants like lycopene help neutralize those molecules before they do their damage. What does that mean for your heart specifically? Research has associated lycopene with lower LDL, the bad cholesterol, with better blood sugar control, and with better blood pressure. It also appears to support the endothelium, that inner lining of the artery, and help protect it from the dysfunction that comes before plaque forms. There's also an interesting relationship with HDL, the good cholesterol. Think of HDL as the cleanup crew. It picks up excess cholesterol from the vessel walls and carries it back to the liver for disposal. When lycopene supports healthier HDL levels, that cleanup process runs a little better. Now, here's the practical tip most people don't know, and it's a good one. Lycopene is absorbed better from cooked tomatoes than from raw ones. Heat breaks down the cell walls and frees the lycopene up, and a little fat in the pan helps your body take it in. So tomato sauce, roasted tomatoes, tomato soup, stewed tomatoes. These are actually excellent sources. Does that mean skip the raw tomato in your salad? Not at all. Eat them both ways. Just know that when you simmer tomatoes with a little olive oil, you're doing something genuinely useful. One catch, and it's a big one in this country. Most jarred pasta sauce and almost all ketchup carry a lot of added sugar and a lot of sodium. That works against everything we're trying to do here. So read the label, or better yet, make your own with canned tomatoes, garlic, and olive oil. It takes 15 minutes, which brings me to number 5, garlic. Garlic is one of the most studied cooking ingredients in the world, and for good reason. When you crush or chop a clove, it produces a sulfur compound called allicin. That's the source of the sharp smell, and it's the source of most of the benefit. Allicin has anti-inflammatory properties. Studies have associated garlic with modest reductions in blood pressure, both the top number and the bottom number. It's also been shown to influence platelet aggregation. Platelets are the cells that clump together to form a clot. That clumping is exactly what blocks an artery during a heart attack. Garlic appears to make platelets a little less sticky, and it's been associated with lower LDL and better HDL. Blood pressure, clotting, cholesterol, that's a lot of overlap with the things that actually cause heart disease. Now, two honest caveats. First, garlic is a food, not a treatment. It supports your heart alongside everything else you're doing. It does not replace a prescribed blood pressure medication or a statin. And no one should stop a medication because they started eating more garlic. Second, and this matters, if you have kidney disease, talk to your doctor or a renal dietitian before increasing garlic significantly. Garlic contains potassium and phosphorus, and those are minerals that people with reduced kidney function often need to watch closely. This isn't a reason to eliminate it. It's a reason to have a conversation with someone who knows your labs. I'd add one more. If you're on a blood thinner or you have surgery coming up, mention any large increase in garlic to your doctor. Because of that effect on platelets, it's worth flagging. But for most people, garlic in your cooking, in your sauce, your beans, your roasted vegetables is a simple, inexpensive win. Two kitchen staples doing quiet work. Let's round out the list. Number 6, olive oil. You have to cook in something. That's not optional. So the real question isn't whether you use fat. It's which fat you reach for. Olive oil is rich in monounsaturated fatty acids, and that's the type of fat most consistently linked with better cardiovascular health. It also contains oleic acid, which carries anti-inflammatory properties, and a group of plant compounds called polyphenols. Together, these have been associated with a better overall cholesterol profile and with less of the vascular inflammation we've been talking about all the way through. Compare that with butter. Butter is mostly saturated fat, and saturated fat tends to push LDL in the wrong direction. Same with heavy shortening and most fried takeout oil. Now, I know olive oil costs more, and I'm not going to pretend it doesn't. So let me be practical about it. You don't need a $40 bottle, regular extra virgin olive oil from the grocery store. Even the store brand gives you the same fatty acid profile. Store it in a dark cabinet, away from heat, so it doesn't go rancid. Use it where it counts. Drizzled over vegetables, in your salad dressing, sautéing your greens, finishing a bowl of soup. If the budget is tight, use it for the finishing touches and cook with something cheaper. Even swapping olive oil in for butter a few times a week is a real change. And knowing this matters more when money is tight, not less, because prevention is almost always cheaper than treatment. Number 7, green tea. And I want to be careful and honest here, because this one gets oversold. Let me start with the caution. Green tea is not automatically safe just because it's natural. Very high intakes, especially concentrated green tea extract supplements, have been linked to liver injury in some people. That's a real documented concern. Too much of anything, even a good thing, stops being a good thing. So please, brewed tea, not extract capsules. And if you have liver disease or you're taking medications, ask your doctor first. With that said, here's what the research points toward. Green tea is loaded with antioxidants, catechins, which help mop up those free radicals and reduce oxidative stress. Studies have associated regular green tea consumption with improved insulin sensitivity, meaning your body handles blood sugar more efficiently. It's been associated with modest reductions in LDL cholesterol, triglycerides, and blood pressure. Look at that list again. LDL, triglycerides, blood pressure, blood sugar. Those are precisely the four numbers your doctor watches when they're assessing your cardiovascular risk. A reasonable approach for most healthy adults is 1 to 2 cups a day. Not 8, not a supplement stack, just a cup or two of brewed tea. And if you simply don't like the taste, that's completely fine. This is not a requirement, it's an option. One more note. Green tea contains caffeine. If you're sensitive to it, if you're pregnant, or if caffeine affects your sleep or your blood pressure, factor that in and talk to your doctor. Number 8, cruciferous vegetables. Broccoli, cauliflower, cabbage, Brussels sprouts, bok choy, kale, this whole family. Their strength is fiber, and by now you know exactly what fiber does. It feeds the gut bacteria. It slows digestion. It steadies blood sugar. It binds cholesterol in the intestine and helps carry it out of the body. The research on cruciferous vegetables consistently associates them with better blood pressure, better blood sugar, lower cholesterol, lower triglycerides, and healthier body weight. That's 5 of the biggest drivers of heart disease, all moving in the right direction from one family of vegetables. Now, I hear the objections. They give me gas. I don't like the texture. On the gas, it usually isn't the vegetable itself causing the problem. More often, it's a gut that hasn't been getting enough fiber, or sluggish digestion, or constipation. If you go from almost no fiber to a big plate of Brussels sprouts overnight, of course you'll feel it. So start small, cook them well, and increase gradually. Your gut adapts. And drink enough water. Fiber needs water to do its job. On the texture, roast them. High heat, a little olive oil, salt. Roasted broccoli and roasted Brussels sprouts taste nothing like the boiled versions most people remember from childhood. And frozen counts. Frozen vegetables are picked at peak ripeness, they're inexpensive, and they keep for months. One small caution. If you have a thyroid condition, you may have heard warnings about cruciferous vegetables. In normal food amounts for most people, they're fine. But if this applies to you, mention it to your doctor rather than deciding on your own. That's all 8. Now here's how to actually use them. Here's what I don't want you to do. Walk out and buy all 8 of these tomorrow. That's how people fail. They overhaul everything on a Monday, hate it by Thursday, and are back to where they started by the following week. That's not a character flaw. That's just how habits work. So do it differently. Pick one, just one. Maybe this week it's swapping white bread for whole grain. Maybe it's adding a can of beans to whatever you're already cooking. Maybe it's roasting a tray of broccoli on Sunday so it's ready to go. Give it 2 or 3 weeks until it stops feeling like effort, until it's just what you do. Then add the next one, and notice how naturally these 8 fit together. Sauté greens in olive oil with garlic, simmer tomatoes with garlic and olive oil, pour it over whole grain pasta, throw in some white beans, roast the cauliflower. That's 4 or 5 of them in a single meal, and it's not a special heart diet. It's just dinner. That's the point I want to leave you with. This isn't about deprivation. Nothing on this list is exotic, and none of it requires you to give up food you love. It's about what you add. Now let me say the most important thing in this entire video, and I want to be very clear about it. Food supports your heart. It does not replace your treatment. If your doctor has you on a blood pressure medication, a statin, or a diabetes medication, those foods work alongside the prescription, not instead of it. Please do not stop a medication because you started eating better. Bring the changes to your doctor and let them look at your numbers and decide with you. That's how this is supposed to work. And if you have diabetes, kidney disease, liver disease, a thyroid condition, if you're on a blood thinner, if you're pregnant, talk to your doctor or a registered dietitian before making a significant change. Not because these foods are dangerous, because your situation is specific and mine is general. Now, some symptoms deserve more than a diet conversation. If you have chest pain or pressure, especially with exertion, get it checked. Shortness of breath that's new or getting worse. Pain radiating into your jaw, your neck, your back, or your arm, unusual fatigue, dizziness or fainting, swelling in your legs or ankles, a racing or irregular heartbeat, any of those, don't wait for your next physical. And if something feels sudden and severe, call 911. Don't drive yourself. I also want to acknowledge what this list doesn't cover. There are excellent heart-supporting foods we didn't get to. Fatty fish, nuts, seeds, berries. Those deserve their own conversation, and we'll have it. But you have enough here to start, and I'll be honest with you about what to expect. There will be no dramatic moment. You won't feel your arteries change. What you'll see months down the line is a slightly better number on a lab report. And years down the line, a heart that's had a much easier time of it. Small, steady choices. That's what your heart really rewards.